Today on Dr. Phil. Once a high school cheerleader, now a drug addict. It's either fix the problem or bury your daughter. I don't know how else to put it.
I see what I've done to her.
She looks like crap. That's not my sister.
I am surprised she's not dead yet. A mother's quest to rescue her daughter from drugs. Look at me right now. What have you had today? Are you willing to do this? Because you got one chance, and it's right now. This family looks like any other family. It could be your family, but one of them is a prescription drug addict, and that has completely changed the dynamics of this family. The addict in the room says it all started when one of them was diagnosed with cancer and another family member made a terrible mistake. This show is for every parent who has ever wondered whether or not their child is secretly abusing drugs, prescription or otherwise. Are there signs going on right now and you don't even see them? It's an eye-opener show that no parent can afford to miss. This is going to be a changing day in your life.
10 seconds here.
I know things are tough out there, but we can do this. Here we go. I want you to get excited about your life.
4,
Get ready,
3.
see. Let's do it. Go, Dr. Phil. Well, you've heard it all before. Your worst fear. Think about it. Gorgeous girl, happy child, cheerleader, basketball player, great student. She had it all. But then she turned to drugs and life changed in a very dark way. This is a story about a mother so desperate to save her daughter's life. She didn't see what was coming. She wrote email after email to me looking for my help. Paula says her 21-year-old daughter, CJ, went down the wrong road. We're talking about a hard drug addiction. Her husband, Jim, says CJ is going to die from mixing prescription pills, street drugs, over-the-counters, anything she can get her hands on. They've tried everything, rehab, counseling, even tough love. They even called one of my former guests, Joni. Now, Joni was a drug addict herself. I dealt with her one time on a primetime special and then subsequently on this show. She asked Joni to help them by shooting kind of a day-in-the-life video of their daughter's addiction. Joni never says no.
It's my sister's birthday, and I have 5 morphine. I'm gonna snort 3 of them and chew 2 of them.
CJ's life today is very sad.
You snorted how many milligrams of morphine?
I snorted 90, and I swallowed 60, so that's 150 total.
CJ has so many talents, and they would shine before she started drug use.
Cheerleading, her smile could just melt anybody's heart. CJ spends most of her time getting Lortab, Xanax, morphine, OxyContin, whatever she can get a hold of.
She's out here making a buy. I think she's getting pharmaceuticals. It looks like she's finally run into luck.
So is this pretty much your whole life, drugs every day?
Not every day. If I don't have the money for oxys, you know, the more expensive things, you know, and I have like $10, I'll spend $10 on some Xanax or something.
Whatever she can get a hold of, whatever she can trade, exchange.
Okay, so what did he give you?
8 morphine pills, and I have to get him a half of weed and a 12-pack of Bud Dry.
Where do you get the weed?
I'm trying to figure that out right now.
CJ's life is constantly searching for the next pill.
Today I've done 80 milligrams of OxyContin and 10 milligram Adderall that a friend gave me. When I mix the OxyContin and Xanax, it makes me nod out.
She's kind of in the category of a garbage head. She takes almost anything.
It's just hard for Paula and I to see how she's throwing away her life at this point.
I do have a habit, and if I keep going out and going, then I'm going to end up in jail.
Well, Jim and Paula are here with their son, Anthony, CJ's brother. How do you feel about being here right now?
Honestly, I feel very, very hopeful. More hope than I've felt in a long, long time.
How about you? How do you feel about being here?
I feel a little nervous, but I feel at peace. I feel at strength because we've been there, we've tried it all, and we feel like CJ's at the end of her life, and it's been a tough road for all of us.
How about you, Anthony?
I feel happy that we're here so that CJ can hopefully get her life back, but at the same time, I feel like we shouldn't even be here in the first place. We shouldn't have come close to being this far.
You'd like to just shake her till her teeth rattled, wouldn't you?
I've actually tried that years ago. I've tried everything that a brother and a friend could have done.
All right, you guys have seen this show before. In fact, you know a lot about me. And you know I'm going to tell you the truth as I see it. You can agree with it or not, but we've got to call a spade here. Yes. So let's just get right down to it. Here are the choices. We're either going to get this fixed or you're going to bury your daughter.
That's right.
I mean, let's just put it on the table. That's the deal. I am surprised she's not dead yet.
We are too.
That's right.
But you're either going to pick her up in a body bag or we're going to turn this around. She is right there. She is on the cusp right now. A lot of different ways she can die. You know, she can get killed by hanging out with these ridiculous, stupid drug addicts. She can OD. She can get so despondent and mentally out of whack that she kills herself. I mean, the risk here are legion. And the reason I wanted to talk to you guys first is because we've got to get this, we've got to be on the same page here, that we understand what we're doing here. It's either fix the problem or bury your daughter. I don't know how else to put it. Am I being clear enough?
Oh, yeah.
Okay, so that means you guys have to get your thinking right, and we have to understand here, because I'm hearing a lot of guilt out of you two about not seeing this sooner, about putting stress and pressure on her. I'm hearing guilt that's running in parallel with denial. You feel like you weren't there for her because you had cancer.
June of 1999, I knew something was wrong and went into the doctor, and they found a mass the size of a baby's head on my right ovary. I was looking at maybe a few years.
There's dreams that are coming true, but there's dreams that are being lost, and that's CJ. And that's very bittersweet to me. We really weren't able to be there for her like we could have been or should have been. We were so busy trying to survive. I can't fully enjoy all the blessings of survival without my daughter. Somehow, CJ disconnected. You can see how CJ just kept distancing herself from the fear of losing her mom.
What I hear you saying is, I feel so guilty because I wasn't there because I had cancer. Well, how dare you? How dare you get cancer? Are you kidding me? That's not something you feel guilty about. That's just a reality of the family.
But there is a part of me that somehow I was lost, and she was lost at the same time.
And it's everything after you said but that I'm focused on here. You've got to get past that, because we're not going to play semantics here. We can't play the blame game and the guilt game. Now, Paula and Jim think that CJ's only taking prescription drugs. But let me tell you, there is so much more to this story they don't know. We're going to put that on the table, because you can't heal, you can't fix, you can't change what you don't acknowledge. We'll be right back.
Very angry with what CJ has done and the choices she made. She's a master at deception. CJ can take you for everything you got. She'll have you buying into her pity party quicker than anything. I felt like grabbing CJ up by the scruff of her neck, throwing her in the backyard, and knocking her from one end of the backyard to the other. And the only thing that's preventing me from doing that is the fact that she's a girl. Sometimes I wish she would go to jail. Maybe that's the swift kick in the hind end that she needs.
Well, that was Anthony, CJ's brother, and he is understandably very upset with his sister because he says that she's just ruining their family. Now, Paula and Jim, they're saying, look, we're out of options. We don't know what to do with our daughter's drug addiction. Now, and CJ has a long list of prescription and street drugs that she takes on a daily basis with no concern or information about the combination of effects, because one drug can potentiate another and make it much more lethal. It can energize it, it can make it be absorbed at a greater rate. The two can get together and create an effect that can be devastating. Now, this is a list of the drugs, and I want y'all to know what she's taken. OxyContin, Lortab, Percocet, Vicodin, Adderall, Xanax, morphine pills, ice, which is meth, that is kind of a new addition, heroin, and a family friend, by her description, shot her up with heroin last week. The parents don't know about this, but they think highly of this friend. So what I'm telling you is this runs wider, it runs deeper, and it runs more dangerous than what you guys are aware of. And she mixes these drugs on a regular basis. Joni, true?
Her favorite combination is opiates and Xanax, or tranquilizers. And that combination together is very dangerous. But on the other hand, she's a bit of a garbage head. She'll do anything that you have.
How is she getting these drugs without money, in your opinion?
In my opinion, CJ gets the drugs by her opportunity of clutching onto men. She spends a lot of time with different men. Not prostitution in the traditional sense, but she's young, she's beautiful, and Paula and I've talked about this. She goes from one man's bed to another, and I believe that's how she supports a drug habit.
What do you think about that, Dad, Mom?
It's very sad as a father. It's very sad. We've lived with two of our greatest fears that I've shared with CJ for a long time. And I told CJ, I said, CJ, my greatest fears are you're going to be in prison for a long time, or we're going to be at the cemetery visiting your grave. And when Joni came in, she told me that my fears were real.
Do you feel ownership in this situation?
Yes, I do.
Because she says to us in talking to her that you've let her down because you had what she calls an affair, and you call it falling away. You call it what?
I broke.
You say you don't like to use the word affair.
Well,
I mean, I don't want to play semantics with you.
No. One day, I went the wrong direction.
Okay. After almost a year of chemotherapy and struggling to survive her cancer, Paula discovered an email from another woman detailing a sexual encounter with Jim, and this is something that CJ is full aware of. Take a look.
It just started as a, hi, how you doing? And it escalated. A few weeks later, there was a time and a place, and I saw that friend and I broke, and I stepped outside of my marriage where I shouldn't have went.
Now, Jim says it was a one-time thing because the thought of losing Paula was just too much for him to bear, but when Paula read this email, she broke down.
Finding out about my husband's affair sent me into another deep, dark pit. And my first thought was, oh my dear Lord, how am I going to get out of this one?
Well, Paula's son Anthony was the last one to know about it, but it affected the entire family.
What? What are you talking about? This was 9 years ago, and I'm just now hearing about it. How did she know about this? And everyone but their dog knew about this but me. My dad and I still haven't sat down and talked about it, and I really don't think we ever will. Is there anything else that you're not telling me that I should know about? Am I in this family or not?
Okay, look. You have to understand, CJ made her choices, but everybody has a role in this. This didn't happen in a vacuum. And then what do you have to do with this? You're the good kid. I mean, everybody looks for a role in the family. You're the mom, you're the dad, you're the good kid. When we come back, we're going to bring her out and talk to her as well. Once I know this family's leaning forward with me, blinders full off, then we're going to deal with it, and I'm going to tell them what that means before she walks out here. Well, today we're talking to Paula, Jim, and their son Anthony about their daughter CJ, Anthony's sister. She's a drug addict. I think she's a very dangerous drug addict. So here's the deal. We have to understand what we're dealing with, and I have to understand what you are willing to do to get her the help and pull her back from what I think is the brink of death. Are you willing to do what it takes?
Absolutely.
Because here's what I'm talking about. You know, we'll bring her out here in a minute, and I'm going to talk to her, and we're going to get as real about this as you can get. And she's either going to agree to surrender her liberty, she's going to agree to do some things to give herself a chance to live, or you have to be willing to do whatever it takes to get a cop and follow her and have her arrested, get her to do a drug buy from an undercover cop, catch her holding, do whatever you have to do. If you have to put her under the jail for 5 years, you have to decide, I would rather have my daughter alive in jail than dead on the street.
That's right.
That's what you have to make a decision about. And because you're in law enforcement, this isn't happy news for you. But I mean, the question is, are y'all willing to do that? Because either she will voluntarily get out of this drug environment, or you have to involuntarily take her out of this drug environment. It's that choice or bury her, in my opinion.
I want my daughter back, and I'll do anything. And we have gone to the law. We have gone to them to try to get them to push her, back her into a corner, to arrest her. We have gone that direction.
Well, let me tell you, this can get done, trust me. And I know you tried to get drug tests 3 times a month and stuff like that. 3 times a month, she's using 10 times a day.
We were doing good.
I mean,
Get it moved from 1 to 2 to 3.
She could be clean on the first one and dead before the second one. We have to be willing to do whatever it takes.
We'll do it.
And where do you come down on this?
I'm willing to do whatever it takes. I'm with them. I'm full on board. The conflict that I have is, yes, I'm in law enforcement, and I see junkies every day I go to work. It's a little bit different when it's your sister, because every time we bring in a new intake, a new prisoner, a new inmate, and I know it's a female, the first thing that enters my mind, God, don't let it be CJ. Not while I'm here, at least. And I pulled up her booking photos. I know her mugshots. And she looks like crap. And that's not my sister. And that tears me up.
But it is your sister.
That is my sister.
And you can be mad at her, and you have the right to be. But you don't want to see her dead.
No. I would rather her wear an orange jumpsuit than be in a grave, absolutely.
Are we on the same page here?
Yes, sir.
Whatever it takes.
Whatever.
Because we could have had her busted right here in LA since she got here. I'm going to tell you about that in a minute. Well, CJ is here. Let's bring her out.
Hi.
CJ, Dr. Phil, how you doing?
Good.
We'll talk to CJ when we come back.
I'm gonna go try to find some drugs.
I just talked to a guy. I asked him if he knew where to get a joint.
Did you get it?
Yeah.
CJ has been here since 1:30. It's less than an hour and a half, and she's already
scored a joint of weed.
Today we're talking to a family in crisis, and it's Paula, Jim, Anthony, and CJ, the daughter in this family that's a drug addict. I didn't say that we have a daughter in crisis. I said that we have a family in crisis because it affects every member of this family both ways. Everybody's involved. Everybody has to be involved. Now, CJ landed here in Los Angeles, and let's take a look at her activities when she hit the ground.
So how are you feeling?
I really want to get high.
Did you bring anything with you?
Xanax, that's it.
I'm gonna go try to find some drugs so I can feel better.
CJ asked him some guy if he can hook her up.
I just talked to a guy. I asked him if he knew where to get a joint. And I said, I'm actually looking for some pain pills. He said, well, I have a buddy that can get pretty much whatever you want.
Did you get it? Did you get it?
Yeah.
CJ has been here since 1:30. That's less than an hour and a half, and she's already
Scored a joint of weed.
That seems a little at odds with being excited about being here to try to get your life in order. Square that up for me.
When I showed up, I was really stressed out, and I figured instead of going to try to get, heroin or whatever, maybe I can just get a joint and that'll calm me down, instead of getting more high, because that's just more destructive.
Look at me right now. What have you had today?
Xanax.
Because you seem real flat. You seem real altered. Agreed? She look right to you?
No.
You don't look right to me.
Yeah, I took a Xanax bar about hour and a half ago, about 9:30.
Why'd you do that?
Because I knew that you're gonna be pretty rough on me, so.
It's going to be pretty rough on you, you think?
I don't know.
Well, you bought marijuana from a person you met after being here an hour and a half. You gave her $20 to buy a T-shirt. She spent it on marijuana. Joni gave her the money for the T-shirt. You made an appointment with somebody for pills last night, right?
Not an appointment.
Well, call it what you want. You were trying to hook up with somebody to get some pills last night at 8 o'clock,
right.
8 p.m.
He gave me, or I gave him the number to reach me at. So yeah, you could call it an appointment.
Last night, you went into a stairwell to make a marijuana deal. And you just been looking for drugs since you got here, right?
Yeah. And actually, I'm happy that I got a joint rather than, a hit of Oxycontin or whatever.
Well, here's the last few days. On the 31st, she scored tar heroin. On the 1st, ice, meth. On the 2nd, $100 worth of heroin. On the 2nd, thought about robbing a pharmacy. Let's rob the pharmacy to get some pills. On the 4th, was into the Xanax. I could go on, but that's what we're dealing with here. You want to die?
At times, yeah, I have. But I don't. I'm surprised I'm not dead yet. So that tells me I'm here for a reason. And yeah, I'm a drug addict. And
so why are you on drugs?
I've been irresponsible, and I've dealt with pain in my life the wrong way.
Pain from these folks as well.
Yeah, and pain that I've caused on my own. Things that I've done. It hasn't just been my parents. They've been the best parents in the world.
I want you to look at them right now. Look at your parents. And I don't mean look at them. I mean, I want you to look your mother in the eye. No, don't look away. Look her in the eye. Why can't you look at her?
Because I see what I've done to her. And she's the most precious woman to me, and how can I do that to my mom, who's already been through enough?
Look at your dad. Look him in the eye. Don't look away. Look him in the eye. You think he cares about you?
Oh, yeah.
What do you see in his eyes? Look him in the eye and tell me what you see.
Love for me, but yet pain and hope, and I see that he'll never give up on me, and he hasn't. Neither one of them have. And I see a very strong man, a man that I love and forgive no matter what.
Look your brother in the eye. Is she in there, Anthony? You look at her, is that little girl in there that you grew up with, that you played with, that you played tricks on the family with?
Yes. But I haven't seen her in years. But if that little girl wasn't in there, I wouldn't be here.
When we come back, Joni thinks CJ is just steps away from prostituting herself for pills. I'm going to ask her about that and ask her what she thinks her future holds when we come back.
In the 4 nights that I was with CJ, she spent the night with 3 different men. She doesn't have a job. She doesn't have any money. How she is getting these drugs is pretty clear. I mean, you can pretty much do the math.
Happy birthday to the woman I admire more than anyone in the world. With all my heart, I am sorry for the pain I've caused you, but it stops here.
Once it starts getting a little bit hard, you know, I hope you're serious about saying you're ready.
Well, that was just 2 weeks ago when CJ apologized to her mother. Of course, it didn't last very long. She's right back where she started, still popping pills, doing drugs on the street. CJ will take a couple of Xanax to calm down, a few Adderall to pep back up, and then some Lortabs to numb her brain, all in one day. She says she prefers prescription drugs over street drugs because at least she knows what she's getting. So where does she get these pills?
CJ's not in denial about being a drug addict. CJ is in denial about what it is she's doing to acquire these drugs, prostitution. She doesn't have a job. She doesn't have any money. I think most of us can assume what it is that she is doing to acquire and maintain a drug habit. In the 4 nights that I was with CJ, she spent the night with 3 different men. There's a man in CJ's life. She describes him as a friend, although when I picked her up at his house, she was in bed with him.
He's not just a drug dealer for me, he's a very good friend of mine also.
She also has a quadriplegic friend that she parties with.
Yeah, and he lays in his bed all day and smokes a lot of crack.
So this is where you're gonna go hang out?
Mm-hmm.
There was a time when CJ related a story about an older man who was going to give her Xanax bars.
He said, well, I was thinking maybe we could do a little trade. And I said, what do you mean? And he said, well, you know, like get your panties off.
She got the Xanax. You can pretty much do the math.
You want another story on that?
No, not really. If there's something you want to say, in general you can, but I don't want to hear a story. No, I'm not interested in story.
No, I'm going to
because I
tell
know
you
the
the
truth.
truth.
I know the facts. The facts are you taking drugs. I don't really care where you're getting them. Do you want to say that you're not prostituting yourself?
I have never had sex with anybody for drugs. Never.
But you were with 3 different men on 4 different nights.
Right.
And you came away with drugs. I mean, that's a yes or no.
No.
Okay, so you didn't come away with drugs.
The Xanax guy, when he said that to me, I said, well, I told my mom that I would go give her a couple. So he said, well, I'll give you a couple to go take to your mom and then you can come back. And because I said, I'm not going to get out of here. After him telling me this, I'm not walking out of here without anything. So he gave me those 2. I walked out of there and it showed 2 right there.
Okay,
and I called him and I said, that's not me.
Okay.
I'm not going to do that.
Okay. So that's not true.
No.
So you've refuted that fully and completely.
Yeah, and that's the honest truth.
So what's your point?
My point
so
is
I'm so
I
relieved.
did not
So
have...
you're not a drug addict. You're not putting your life in danger every day. You're not killing these people from the inside out, and we're not going to find you in a body bag because you shut down your respiration from an overdose. Is that the so?
The so is I did not have sex with that guy for those Xanax bars.
Okay.
And Dr. Phil, I don't mean this disrespectfully, but you can beat me up all you want. But obviously I beat myself up enough.
Listen, don't play the victim with me, lady.
I'm not
don't
trying
play
to.
the victim with me. You got to own what you're doing. Joining us today is Dr. Travis Stork. Dr. Stork is the host of the new hit show, The Doctors, where they talk about the medical realities of your life. She says, I don't take street drugs, I take prescription drugs because I know what's in them. Now, she's getting them from some guy's hand. She's not getting them from a licensed pharmacist prescribed by a physician. Can she know what's in those drugs?
Absolutely not, but it's not safe either way.
Of course it's not safe either way, but the truth is there are a lot of counterfeit drugs on the street, and they're not mixed with precision, and you don't know what's in them, true?
Absolutely.
So you really don't know what you're getting. They can be stamped, they can be labeled, and even if they are prescription drugs, is it still dangerous?
Yes.
Tell her why.
Almost every single night in the ER, I see someone come into the ER, oftentimes from prescription drug abuse, an overdose where they stop breathing, and we just have to pray to God that they get to the ER in time before they're dead.
I mean, I'm a drug addict, you know? But, I mean, I've seen his prescription bottle, but that doesn't mean that it's still safe.
Okay, let's assume that those things are brought to you from on high, from the most perfectly controlled pharmacy in the history of the world, and you're getting exactly what you think you're getting.
Right.
You're playing Russian roulette.
I agree with that.
Because I checked, and I don't think I saw a medical degree on your intake form.
No, I'm not a doctor.
So there's a fair chance you don't know what the hell you're talking about, and you don't know what you're taking. You don't know how this drug interacts with this drug. And isn't it true that you often can't remember what you took when?
Yeah, that's true.
So
that's
you don't
why
know
I say
if this
I'm
is the 8th
surprised I'm not
tablet
dead yet.
or the 20th tablet. You don't really know with precision.
That's why I'm sitting here saying I'm a drug addict and I need help.
I want to introduce you to somebody when we come back. We're going to meet a family who recently lost their 20-year-old son to a deadly mixture of prescription drugs. They're here. They got something, I'm sure, to say to you, to these parents, and to all parents out there. We'll be right back. Today we're talking about how easy it is for prescription drugs to ruin a life, to rob health, to tear apart a family. And they're so easy to get these days over the internet and every other kind of way. Paula and Jim, we're talking about 2 loving, caring, devoted parents. We're not talking about head in the clouds enablers here. They're struggling with their 21-year-old daughter, CJ, who has, by her own description, a drug addiction. She says, "I can't believe I'm not dead." Well, earlier this year, actor Heath Ledger died of an accidental overdose of prescription drugs. He combined a total of 6 different prescriptions, including antidepressants and painkillers. Arlene and David know firsthand what it's like to lose a loved one to prescription drugs. Their 20-year-old son, Jeffrey, died a week before Heath Ledger passed away. David found his son in bed, dead. He took Oxycontin, diazepam, and anti-anxiety medications as well. I am so sorry for your loss. One thing you'll never hear me say is I know how you feel, because if you don't walk in that room and pull back those covers, you just can't possibly know. What do you want to say?
We just want to bring awareness to anyone who's listening or watching to this program that it hit us, it just blindsided us. You know, we had no way of knowing. There were no symptoms other than probably a month before. He just was tired, and, you know, and it just blindsided us. It is, as Dr. Phil has said, they can get it wherever. He was a good boy. He worked, had a job, was a good student. He was in college, had future plans, and, you know, our society, we all want to escape all the stresses.
Well, David, what do you think about what you've heard me say to these parents? What would you give for a second chance to do what I'm telling them?
Dr. Phil, if I had that option, if that option had been given me, I would be going down the same road you've been given. I'd take the same steps. But that wasn't the plan, and that wasn't the option I got. I was completely blindsided. We didn't know until the day I walked in to my son's room.
I want to introduce you to 2 people. A year ago, Joni hit the streets to find our former guest that you've met, one of the Heroin twins, Tekoa. She was relapsing, she was homeless, she was pregnant, she was prostituting herself for drugs. Joni brought Tekoa to me, and we sent her to Rich Whitman at La Hacienda. You'll remember Tekoa. She was what y'all dubbed one of the Heroin twins. Rich is back with Tekoa, and Tekoa is celebrating 1 year of sobriety. She is totally clean at this point. Tekoa, stand up. Tekoa, stand up. So how familiar does this story sound to you?
Very familiar. I know exactly what you're feeling. You know, I've been there, and I'm here to tell you, you don't have to live like that anymore. You don't.
I flew Rich in here today from La Hacienda in Texas, and he has agreed and is prepared to take you from here to there. You don't go home, you don't pass go, you don't go do one more score. The first thing they're going to do is search everything you have to make sure you're clean and take you to rehab. And I'm going to tell you folks, there's a good chance she's going to be gone a long, long time. Are you willing to do this?
Yeah.
Because you got one chance, and it's right now.
If I don't take it, I'll end up dead or in jail, probably dead first. So yeah, let's go right now.
We'll see. Be right back. Today we've been talking about a very complex and life-threatening disease and situation. The main thing I want you to do after this show is go to drphil.com, because I am going to list the warning signs that you as parents need to watch for to see whether or not your kids may be involved in some type of drug activity. I want to thank my guests for being here today. Guys, I know this is tough, but I think you've taken a big step in the right direction, and they don't play at this at La Hacienda. It is, in my opinion, drug rehab-wise, there's La Hacienda and everybody else. If you're struggling with an addiction, or maybe it's your child, you can tell us your story by logging on to drphil.com. Click on Be a Guest. Maybe we can help you as well. Don't forget to go to drphil.com. I'm going to have all the information you need right there. Thanks for being here. So long.